So we're doing the Pro G35 is the live demo, and this is 35% glycolic acid. All of the Pro G also contains the copper tripeptides, which are a wonderful, really rejuvenating sort of miracle that we've added, just peptides that we've added to the peels. And in the case of the Pro G35, this is unbuffered, so the pH is very low. It's at about 1. And that's the one that we're going to demonstrate. Although, honestly, the whole Pro Peel series, whether it's the L20, the Pro G70, or the Pro G35, have the same protocol in terms of prepping the patient and all of this. The difference will be in patient selection. For the Pro L series, the Pro L20, you're going to typically do that on a patient whose skin is more sensitive, but you would be opting for that instead of the Blue Tidal because possibly they have some active acne or they really need to have an acid peel. They have some kind of an indication for that. It may be some hyperpigmentation, which is going to be better treated with the lactic than simply with the enzyme treatment. In the Pro L, there's one caveat. The Pro L, we say, is really for patient selection for more sensitive skin. But we do want you to remember that because the Pro L is so gentle at just 20% lactic, the patient themselves experiences very little to no tingling. And so it's the job of the skincare specialist to be positive that you have very thorough wash off. The Pro L, which is on the very low end of the aggressiveness spectrum, is the one product where we have seen cases where an hour or two later the patient calls back and says, wow, now my face is turning red or my face is stinging. That always relates back to the person not having the acid thoroughly washed off. A big pearl I'd like to give you is in the case of the Pro L, if you have a sink in the room, after you've washed off, ask the person to go to the sink. If you don't, and to rinse 15 times to be sure that it's all adequately washed off. If you don't have a sink in the room, then use your Vita-C peptide spray and do it after you've done good wash off with your 4x4 that are water soaked. Then use your spray another 15 times. It will save you a lot of problems later. And again, it's a caveat. Obviously, we're not talking about a very strong acid here, but we want to really ascertain that it's all washed off. Then when it comes to our Pro G70, remember that in the spectrum of skin aggressiveness, of depth of peel, we have our Blue Tidal, then our Pro L, then our Pro G70. It is a 70% glycolic, but it's partially buffered. And because it's partially buffered, it's actually slightly less aggressive than the next choice, which we're just about to demonstrate, which is our Pro G35. For those of you who've had a lot of familiarity and been using our glycolic peels and our cosmetical peels for some time, you'll know that the Pro G series is amazing for acne. It's also very good for someone who needs some mild skin rejuvenation. So we're just about to demonstrate our Pro G35, and the person that we'll demonstrate on, our patient today, is someone who has some mild acne, especially on his forehead. This is actually his second in a series. And just as we had mentioned that we have the series concept for the Blue Tidal, this is also very true for the Pro series of peels from Cosmetical. They are really not meant to be solely standalone. And in all of these three peels, the Pro L20, the Pro G70, and the Pro G35, you ideally want the patient back every 1 to 2 weeks for a series anywhere from 6 to 8. And then I absolutely recommend that when they finish their series, that you have them return for a maintenance peel. That's of the utmost of importance, and that should be anywhere from 4 to 8 weeks, depending on how long it took the person to clear with the original series, depending on the person's really their schedule, how busy they are, do they have the time to come in. You'll have some patients who want to come every 2 weeks for a while if they've been coming every week. And this really, when I compare the results that we see with the Pro G series especially, compared to even, let's say, a monthly facial with steaming and all, the results are very dramatic, and it's very beneficial to people to come for their maintenance Pro peels. I will also, one more time, reiterate that we're often asked which of the cosmetical peels can be used with equipment. I mentioned that the blue tidal enzyme is something that would be safe to be used with certain equipment like the microderm. Let's also talk about steaming. None of the Pro Series peels are meant to be used with steaming. Please keep that in mind. We don't want to be applying acid to a face that has been steamed, or even vice versa, because, in other words, don't do the peel, wash it off, and then steam. We know that when we steam the skin, we increase absorption of product by 10 times. So again, this is meant to be used just as we're about to demonstrate. Now, in this patient again, the indications are that we're doing this for some mild acne. I will say that this is his second peel, and I will ask you, how do you feel? What kinds of results did you feel after your first Pro G?
I feel that the first one definitely cleared up some of my forehead skin, and well, that was really what the main objective was.
Right. Yes, and I believe I had done a little bit of a lesion count the first time, and I think that there were about 5 erythematous papules on his forehead. Now there are 0, and we're also going to be showing some stills up on our website, but we really are seeing, after just one, a nice improvement. And then the other thing is that there's some very, very early almost sort of freckling that we're seeing on the lateral face, and as a dermatologist, I believe that there's a little chance that unchecked and untreated, that could, as time goes on, become several solar lenticos. So really the indications for this are, first, to clear acne. I don't know, do you feel any change in the oiliness of your skin or not yet?
Oiliness, not really, no.
Okay, yes, and
but
that's because
definitely
he's only
the
had
lesions,
one.
like you mentioned,
Yes.
it's almost like my skin has calmed down.
Right, yeah, so new breakouts seem to have lessened,
Right.
and the existing breakouts resolved.
Right.
Okay, yeah, and that's really about where we want to be entering the second one. Now, Michael had for his first the Pro G35. If he had had the Pro G70 and came back to us a couple of weeks later and said, wow, I don't see any change at all, then you might graduate from the 70, which is again higher number, but it's partially buffered. You might rev up for the second treatment to give the patient the 35%. So we're going to do the same kind of thing in terms of prepping the face, but I will say that in this case where there's no history of skin dryness, I'm actually going to use an alcohol pad. And remember that, so I'm going to always ask the patient to close their eyes during the whole time. And remember that we use rubbing alcohol, isopropyl alcohol, or acetone to prep faces before peels, because these are called degreasing agents. And again, I want to emphasize, it's not going to be a matter of helping the person's oil level. We do it to actually sort of guarantee that we'll get a little better penetration of our peeling agent. And so we've got our peeling agent, the Pro G35, and I do sort of want to mention to you that the Pro G35, the name of the product is in a white box, just for you to realize. I think that those of you who use both realize that we also make the Pro G70, and the product there is in a black box, the product name. So just for you to realize, if you're pulling things quickly off of your shelf. Okay, now I'm going to ask you again to close your eyes. And just as we had stated, what we want to do is we want to, first of all, we'll just sort of like wipe down the skin and just make sure that there's no lotion left. I have most of my male patients use our tinted sunscreen, so we want to make sure that the face is clean, and now I've ascertained that it's totally clean. Now we're going to start on the forehead. If there were active acne lesions, when we're using the Pro-G35, the unbuffered glycolic, we would find that some of those lesions might actually come visibly more to the surface. Really, there's a nice improvement after his first peel, and so I don't really see any active acne lesions as he had with his first peel. But for those of you who are treating people their first peel, or maybe even their second or third, and they have active lesions, do not be distressed if you see the active lesions turn redder and really then just almost seem to be popping out. Now, as far as timer goes, we are not going to be leaving this on for too long because I will first, I'm fine. We're going to probably leave this on for about 2 minutes and then we're going to be asking the patient. But I will ask you right now, Michael, are you feeling on a scale from 1 to 10, are you feeling any tingling, pins and needles? And would you say from 0 to 10?
Probably 7, 7.5.
Okay, so
I
again,
feel a little bit less than last time, but I definitely feel it again, especially in the beard area.
yes. Remember that men do a wonderful job of physically exfoliating their face every time they shave. So they're really getting increased absorption of your peel product in their beard area. So we're soon going to be at a minute, and Michael said he has about a 7.5 out of 10 in terms of sort of his discomfort level. And we want to make this relatively comfortable. Notice too, he said something that is going to be very reproducible. He feels a little less burning than the first time because the skin does build a tolerance to glycolic. Michael, I can actually remove it from your beard. What are you feeling now? Is it calming down, that tingling feeling?
A little bit, yeah, a little bit.
Right, and that's also not unheard of. That we do see sort of reproducibly also. That when we first put it on, you can feel, on my own skin, I do the Pro-G to myself, and I do feel this tremendous sense of pins and needles, and then within sort of a minute, it seems to calm down. And always, I do want to mention, it's very important, this is an unbuffered acid that you're putting on this patient. And this is true for the Pro-G35, for any of our treatments. Never leave the room and never take your eyes off of the patient when they have any of these peeling agents on them. If, a patient calls, you've been waiting for a patient call, there's, the intercom comes, that patient's on the phone. Everyone in your facility should know that you don't take your eyes off of the patients while you're doing the peel. We're looking, and I'm just wanting to visualize his entire face, and I'm seeing that no, there's no redness that's formed anywhere. But if, for instance, Michael had some acne cysts, then he could, and so we're just at about a minute and a half. I'm going to start on the beard area. If he, for instance, had acne cysts, we have had cases where a really inflamed acne cyst can form a little water blister with the product, with this Pro-G35 on the skin. So it is absolutely incumbent upon you to keep eyes on patients the entire time. Sounds like just a silly little piece of advice, but it's of the utmost of importance. Okay, and we're just now at about the 2 minutes from when we started. So typically, I like to do the wipe off. And by the way, this is just water. This is tepid water on a 4x4. We're well aware of the fact that companies sell quote-unquote neutralizing solutions to neutralize the acid away. There's one company that has done that for years. Water absolutely does neutralize glycolic. We know this, it's just, a chemical reaction that takes place. The water has the pH of 7, this has a pH around 1. So when you start to wash it off with water, you're neutralizing product. Michael, are you feeling any kind of a reaction as I'm washing it off of you?
Yeah, it's kind of stinging here and there.
Okay, and it's very interesting because that actually is pretty red, and you'll remember that I took it off of the beard area first,
Right.
but that's my own operator oversight there, that obviously the mustache should be included in the shaved area. If there were more acne lesions, you would see that there would be getting red. Actually, there's just a little bit of acneiform lesions right here, and they are redder than pre-peel. And again, because this is somebody who really experienced a good degree of burning, we want to do a few things. I'm actually going to take off my glove, and the very first thing I'm going to do is I'm going to use the peptide spray. So I'm going to ask you to keep your eyes closed. I'm sorry, yes. Keep a good distance, okay? And then I'm going to come right in with the VitaSoothe. And sometimes to really get the utmost out of the VitaSoothe, you've got to sort of just, pat a little bit of the spray off. Now, most important thing, remember we said for best practices, you never want to leave the room, you never really want your attention diverted from the patient's face, and also best practices, you always need to ask the patient, how are you feeling? So now, if we remember that he started with a 7.5, Michael, what would you say now?
I'd say probably a 3. I still feel some tingling.
Right, and I will say that it's not that uncommon, like you almost feel, could you say a little bit like a sunburn?
Yeah, I guess you could say that.
And that does happen, but first of all, you've got to be sure, is there any particular area where you're feeling more of a burning?
Actually, my lip here.
Okay, so that's such a help, because that's sort of the patient directing us that probably there was not adequate enough wash off. And so again, this sort of gets back to the direction I was giving you about the Pro-L. Because in the Pro-G35, which is the demo we're doing now, it is a very low pH, unbuffered product. The patient really can give you a very good indication of how adequate the wash-off was. With the Pro-L, where most patients feel no tingling, they do not honestly know if they can't help to direct us if there was an area that went unattended in terms of wash-off. So for the Pro-L, for sure, either having them go to the sink and wash it off 15 times, or a lot more of the VitaC spray if you don't happen to have a sink. I think in this particular case, we're going to do another round of the VitaC peptide spray to really ensure that we have enough of a wash off. And this patient has beautiful long eyelashes, so okay. So I just wiped them of a little bit of the last round of the VitaC. Okay, so we're going to go one more time. And don't worry, you can be sort of dousing the person. I love to emphasize to my patients that we're giving them VitaC and peptide. This has the algae firming peptides from the Hawaiian Sea and the vitamin C, a lipophilic form of vitamin C. So this is a very nice topper to the Pro-G peel. Remember that because he has just had the Pro-G on his skin, he's getting a lot more deeper and better penetration of the products that we're putting on now, which were the VitaSoothe again, which is giving him that broad spectrum antioxidant shield plus moisture retention, which by the way is very nice for people who are having a peel. We then put on the VitaC peptide spray, and now last of all, we are going to put just a little bit of our daily replenishing, which is the SPF 30 chemical-free sunscreen. And I had mentioned that the vast majority of my male patients are on this product, and I had stated that it is slightly tinted. Actually, we use a little bit of iron oxide, but a lot of the tint in this product is the beta carotene. And I am sort of wanting to demonstrate to you that in no means does this look like a makeup on the patient's face, but it is really sort of a nice finisher. And we're doing this peel in South Florida, so although it's January, we still have really a very measurable UV exposure in South Florida. And I think in the case of any of our pro peels, it's a good idea, even January in Massachusetts, where you've still got a whole lot of UVA, we want to be sure that people leave the Pro Series peels with sunscreen on them. Now, I'd like to ask once more, do you feel any, now that we've put on, more of the hydrating spray? Yes, I think you've got a little bit, yep, I think that you may have a little bit on. And I don't know if the camera's showing this, but these are certainly very enviable eyelashes. And so, how are you feeling now? Do you feel you have it on your lashes?
Yeah, I think I should rinse my eyes for a second.
Sure. Okay. In fact, here's a little bit of water, and then I have so much product on me, so I just want you to.
Sure.
Okay. And do you feel, would you say still that tingling, is it about the same, that slight sunburn feeling?
Yeah, there's a little bit of tingling, but it's really subsided, really.
Great. And that's sort of what you'd expect. Sort of the best way to counsel the patient is that you may feel almost a little bit of a feeling like a slight sunburn, but that feeling will definitely subside, and within the next few hours it's going to be less and less. Right. But would you say that there's any discomfort?
No, it's just I can feel something, but it's not really, it's not a discomfort.
Great, all right, thank you very much, and now we'll schedule you for another one next week. Thank you.